Hey guys, this is Dr. Adriana Lopez with MacArthur OBGYN, ready to answer some questions about the Gardasil vaccine. So let's get started. So this is a really common infection that can affect men and women, which long-term can increase the risk for cervical cancers, vaginal cancers, anal cancers, as well as certain head and neck cancers. It is actually estimated that most people will have HPV infection at some point in their life. And at this given time, about 80 million people in America would have this infection. Most HPV does not cause any symptoms or not cause problems. About 9 out of 10 infections, people will clear on their own within a couple of years. But for some people, including men and women, this infection can lead to increased risk for cancer. It is an immunization designed to help protect men and women against certain types of cervical cancer, anal, vaginal, penile, as well as head and neck cancers that can be caused by HPV. The Gardasil vaccine is actually recommended for girls and boys as young as 9 to women and men age 45. So people less than age 15 would need 2 doses, and those older than 15 would need 3 doses. If you had to interrupt your schedule for some reason, it's actually recommended that we just start back up where we left off. At this given time, it's not approved for use in pregnancy, so we would have to wait till after pregnancy to give you this vaccination. It works extremely well. Since its recommendation in 2006, we've actually seen about a 64% decrease in genital warts and precancer cells diagnosed in teenage girls in the United States. Like any vaccine, there can be injection site reactions that can cause pain, swelling, redness, maybe see some muscle or joint pain at the site of administration. Usually really mild and self-limited if people have reactions at all. Can you get HPV from the HPV vaccine? And the answer to that is no. This vaccination is made from the proteins of the virus and not the actual virus itself. So it'd be impossible to contract HPV from the vaccination. The answer is yes. There are so many different strains of HPV. Gardasil protects against the high-risk 9 as well as the strains that cause genital warts. You still need your routine cervical cancer screening with your OB-GYN.